staff? How do I engage other private partners who may be willing to make an investment in making our facilities better? And most importantly, how can I improve the quality of healthcare that we can provide to our community? So I really think that the budget piece, even though it was in a very difficult situation, was very critical to establish the whole package of services that would allow our Health Systems Corporation to really move forward.
If I might jump in a little bit about health economics too for the viewer. People hear these large numbers and they say, well, why 14 million? Why was $14 million necessary in an emergency appropriation? Why was as much as 60 million necessary for the whole health system? Well, a couple of things to realize. Number one, as was pointed out by the chairman of the Health Committee in the House earlier today to me, we are the 4th largest community hospital system in the country because we have so many community hospitals here in an isolated environment. So in many ways, we have a few very wonderful private hospitals, but on the neighbor islands especially, we have much less in the way of private support. So we are a large public hospital system, number one. Number two, we never turn anyone away. And that's, I think, a big part of the mission statement at the Hawaii Health System Corporation. Maui being the only hospital available, they would never turn anyone away. Westlow's a very good CEO there, and he would not let someone go without care. But if they have no insurance, that will be red ink. And that's the kind of thing that these dollars coming from the taxpayers and state government is paying for. It's paying for every citizen to make sure they're going to get health care. Same thing goes for Kona and Hilo, whether it's Howard or Earl. When they see a patient coming in their doors, they don't ask, are you insured? Do you have great insurance? They ask, what do you need from a healthcare standpoint? So that's referred to often as uncompensated care, meaning that there's no insurance company or government pay or anything to pay for some care. And so when you have large amounts of monies that don't ever show up, you still have to pay your nurses and your doctors and the pharmacy people to prescribe to bring the medications or the equipment for a surgery. That's what those real dollars are going toward. So we weren't at the legislature going during a real tough time when more people maybe would be uninsured or more people would be in desperate straits without a job. We weren't going to let them worry that their hospital would close. And that's the reason that at least I was very proud to be a part of this process with my colleagues to see that where there were cuts, of course, all across government, there weren't healthcare cuts in the core hospital system, and I think that's what people should take away from the work that Terry Ige did.
I would agree. Bob, from a Native Hawaiian perspective, I know that the healthcare needs are being addressed by other programs that are provided strictly for Native Hawaiians, but do you get a sense from your constituents, how they feel about the Hawaii hospital system?
For us, at the Office of Hawaiian Affairs, we are going through a major strategic planning process. We've got this beautiful strategic plan, but it needs to be operationalized. And in the operationalizing of that plan, we have established clear strategic priorities. Health is a major one. And so, I want to thank you all for allowing us to be a part of the conversation so that we know that the needs are many, the resources are few, and by working together, we are a state agency, yes, but clearly we need to be working very closely with all of you here at the legislature in working to resolve the many health issues that face our people, as well as all of us who call Hawaii our home. So, as a trustee for our island, for the island of Hawaii, I appreciate all that you folks are doing because what you do ripples across the entire community, our people included.
Well, I think one of the issues, I'm glad you brought up the whole aspect about coming up with a strategic plan for healthcare because, being one of the aspects, because I think going forward, and we do need to spend more time explaining exactly what was passed, but I think even more importantly is to think about what more we can do down the road. I think this is a tremendous foundation upon which to build, but we know that there are additional issues that have to be addressed. And you know, so, but I'm very keenly aware that if we did not put this into play now, it'd be very difficult to talk about the future in that regard.
Yes, absolutely.
So, but I think that you raise a good point about the strategic planning. David, you know, let me ask you too, like, you know, some people may think, well, you know, we continually provide additional funds for the hospital system because they demand it, but how can we assure people that there's going to be accountability and, you know, in fact will result in the improvements that we foresee?
You know, I think one of the things that Senate Bill 1673 also does is really empower the board to be more region focused. The makeup of the corporate board now is really driven by the CEOs in each region, and each region will appoint additional board members so that clearly the needs of the regions will be paramount on that corporate board. You know, it becomes the other part in the whole mix of things is we've included a requirement for an annual internal management and operations audit, really looking at the responsibilities that are responsibilities and services delivered by the corporation to the regions and vice versa. And you know, part of that whole notion of continual process improvement, and you know, we always believe that it would be good to incorporate that into your corporate culture rather than impose it outside. I mean, I think that that's very important. The other thing that we did clearly from the budget perspective is we did separate the corporate administrative costs from the operating funds on the region, and so that in our budget process, it'll be very transparent about what funds are being provided for the corporate offices and what services are attached to that, and then really what are the operating funds that will be provided to each region to really deliver health services to the communities. So I think that those things are very important in our efforts to go forward, and you know, the whole process of engaging the community in determining levels of service pretty much assures that the community will be engaged. And I do believe if you talk to the CEOs and even the regional board members, there really has been a kind of taking ownership for the facilities in each and every region. So I think that that's a good thing as we move forward.
Mm-hmm. Yeah, Josh, maybe you can comment on the two regional boards,
Right.
both for East and West.
Well, yes, we so 2 years ago we first established regional boards, which was an enormous